Diagnosis 101 – Your Guide to Wellness. Bowel incontinence, a challenging condition affecting many, is the focus of our latest video. Join us as we shed light on this sensitive topic and explore its causes, symptoms, and potential treatments. Don't forget to subscribe and hit the notification bell to stay updated on all our future medical content. We're here to keep you informed and empowered. Bowel incontinence, also known as fecal incontinence, is a medical condition characterized by the involuntary loss of control over bowel movements. It involves the accidental passing of liquid or solid stool from the rectum, often at unexpected or inconvenient times. Bowel incontinence can vary in severity, ranging from occasional leakage to a complete inability to control bowel movements. Causes. Bowel incontinence can result from various underlying causes, including muscle weakness, weakening of the muscles in the rectum and anus, often due to age, childbirth, or certain medical conditions, can contribute to loss of control over bowel movements. Nerve damage, damage to the nerves that control the rectum and anal sphincter, which can occur due to conditions like diabetes, multiple sclerosis, spinal cord injuries, or pelvic surgery, may lead to bowel incontinence. Chronic diarrhea or constipation. Frequent diarrhea can overwhelm the ability to hold stool, while chronic constipation can lead to impacted stool that triggers involuntary leakage around it. Rectal prolapse. When the rectum protrudes through the anus, it can interfere with proper sphincter function, causing bowel incontinence. Anorectal malformations. Congenital abnormalities in the structure of the anus and rectum may result in bowel incontinence from birth. Neurological disorders. Conditions affecting the central nervous system, such as Parkinson's disease or stroke, can disrupt the nerves controlling bowel movements. Inflammatory bowel disease, IBD, Crohn's disease or ulcerative colitis can lead to inflammation in the digestive tract, contributing to bowel incontinence. Symptoms. The primary symptom of bowel incontinence is the unintentional passing of stool, which may be accompanied by urgency, a sudden and strong urge to have a bowel movement, inability to hold gas, difficulty controlling the release of gas, emotional distress, feelings of embarrassment, shame, or anxiety related to the condition. Skin irritation. Leakage of stool can cause skin irritation and discomfort in the anal area. Treatment. Treatment for bowel incontinence depends on the underlying cause and severity of the condition. Some common approaches include dietary changes, adjusting the diet to regulate bowel movements and prevent diarrhea or constipation. Medications. Certain medications can help manage diarrhea, constipation, or reduce bowel contractions. Bowel training. Techniques to help regain control over bowel movements and establish a regular routine. Biofeedback. Training to improve awareness and control of pelvic muscles involved in bowel movements. Surgery. In severe cases or when other treatments are ineffective, surgical interventions may be considered. Did you know that ancient Egyptians used honey, figs, and other natural remedies to manage bowel incontinence? Their early attempts at finding solutions show just how long this condition has been impacting human lives. Early texts and documentations. References to bowel incontinence can be found in some of the earliest medical texts. Ancient physicians like Hippocrates and Galen discussed the condition and attempted to describe its causes and potential treatments. Royal physicians. Bowel incontinence was often a private matter, even for royalty. Historical records indicate that some medieval kings and queens sought advice from royal physicians for remedies and management of bowel incontinence discreetly. Early surgical interventions. In the 17th and 18th centuries, some physicians attempted surgical interventions to treat severe cases of bowel incontinence. However, these procedures were risky and often resulted in complications due to the lack of advanced medical knowledge and technology. The rise of sanitary products. During the 19th century, advancements in textile manufacturing led to the production of better absorbent materials. These materials were eventually adapted for medical use, and early versions of modern-day adult diapers were developed to assist those with bowel incontinence. Development of incontinence pads. In the early 20th century, nurses and medical professionals began creating incontinence pads using various materials to help manage bowel incontinence in hospital settings and at home. Neurological discoveries. Throughout medical history, there have been significant discoveries in understanding the neurological factors contributing to bowel incontinence. These findings have played a crucial role in developing targeted treatments and interventions. Modern treatments. With advances in medical science, a variety of effective treatments for bowel incontinence have emerged. These include biofeedback therapy, medications, dietary changes, and surgical options. Quality of life improvements. In recent decades, increased awareness and medical advancements have led to a more open and compassionate approach to managing bowel incontinence, significantly improving the quality of life for affected individuals. Disclaimer: this video is for educational purposes only and should not be considered a substitute for professional medical advice. If you or someone you know is experiencing bowel incontinence, please consult a qualified healthcare provider for personalized guidance. Thank you for joining us on this insightful journey into the world of bowel incontinence. Remember, understanding and awareness are crucial steps in supporting those dealing with this condition. Together, let's foster empathy and compassion in healthcare. Like, share, and spread the word. Diagnosis 101. Stay curious, stay informed, and stay healthy.